Female sexual interest/arousal disorder represents one of the most prevalent yet misunderstood sexual health conditions affecting women worldwide. This disorder, formally recognized in the Diagnostic and Statistical Manual of Mental Disorders, encompasses a persistent reduction or absence of sexual interest, sexual thoughts, and arousal responses that causes significant distress or interpersonal difficulties. The condition affects millions of women across different age groups, cultural backgrounds, and life circumstances, making it a significant public health concern that deserves comprehensive understanding and appropriate clinical attention. The clinical presentation of female sexual interest/arousal disorder manifests through various interconnected symptoms that can significantly impact a woman's quality of life. Women experiencing this condition often report a marked decrease in sexual desire, reduced frequency of sexual thoughts or fantasies, and diminished initiation of sexual activity. Physical arousal responses may also be impaired, including reduced genital sensitivity, decreased lubrication, and minimal physical responses to sexual stimuli. These symptoms must persist for at least 6 months and cannot be better explained by other medical conditions, relationship problems, or substance use to meet diagnostic criteria. The etiology of female sexual interest/arousal disorder is multifactorial, involving complex interactions between biological, psychological, and social factors. Hormonal fluctuations, particularly declining estrogen levels during menopause or postpartum periods, can significantly impact sexual desire and arousal. Neurobiological factors, including alterations in neurotransmitter systems involving dopamine, serotonin, and norepinephrine, play crucial roles in sexual motivation and response. Additionally, various medical conditions such as diabetes, cardiovascular disease, and neurological disorders can contribute to the development of this condition by affecting blood flow, nerve function, or overall health status. Psychological factors contribute substantially to the development and maintenance of female sexual interest/arousal disorder. Past traumatic experiences, including sexual abuse or assault, can create lasting impacts on sexual functioning and desire. Anxiety, depression, and chronic stress can significantly interfere with sexual interest and arousal responses. Body image concerns, performance anxiety, and negative sexual experiences can create psychological barriers that perpetuate the condition. Furthermore, relationship dynamics, communication patterns, and partner factors can influence the development and severity of symptoms. The diagnosis of female sexual interest/arousal disorder requires careful clinical assessment by qualified healthcare professionals. The diagnostic process typically involves comprehensive medical history taking, physical examination, and psychological evaluation. Clinicians must rule out other potential causes of sexual dysfunction, including medication side effects, medical conditions, and relationship problems. Various validated questionnaires and assessment tools can help quantify symptoms and track treatment progress. The diagnostic process should be conducted in a sensitive, non-judgmental environment that encourages open communication about sexual concerns. Treatment approaches for female sexual interest/arousal disorder are diverse and often require individualized, multimodal strategies. Psychological interventions, including cognitive behavioral therapy, mindfulness-based approaches, and sex therapy, have shown significant efficacy in addressing psychological and interpersonal factors contributing to the condition. These therapeutic approaches help women identify and address negative thought patterns, improve body awareness, enhance communication skills, and develop healthier sexual attitudes and behaviors. Pharmacological interventions have also shown promise in treating female sexual interest/arousal disorder. Flibanserin, the first FDA-approved medication specifically for treating hypoactive sexual desire disorder in premenopausal women, works by modulating neurotransmitter systems in the brain. Bremelanotide, another approved medication, acts on melanocortin receptors to enhance sexual desire and arousal. Hormone replacement therapy may be beneficial for postmenopausal women experiencing symptoms related to hormonal changes, though risks and benefits must be carefully considered. Lifestyle modifications can significantly impact sexual health and may help alleviate symptoms of female sexual interest/arousal disorder. Regular exercise improves blood flow, reduces stress, and enhances overall well-being, all of which can positively influence sexual function. Stress management techniques, including meditation, yoga, and relaxation exercises, can help address psychological factors contributing to the condition. Adequate sleep, healthy nutrition, and limiting alcohol consumption can also support overall sexual health and well-being. The impact of female sexual interest/arousal disorder extends beyond individual suffering to affect relationships, self-esteem, and overall quality of life. Women with this condition often experience feelings of inadequacy, frustration, and disconnection from their partners. The condition can strain intimate relationships, leading to communication problems, emotional distance, and relationship dissatisfaction. Understanding these broader impacts is crucial for developing comprehensive treatment approaches that address not only sexual symptoms, but also relationship dynamics and emotional well-being. Cultural and societal factors significantly influence how female sexual interest/arousal disorder is perceived, discussed, and treated. Cultural attitudes toward female sexuality, gender roles, and sexual expression can affect women's willingness to seek help and their treatment experiences. Healthcare providers must be sensitive to cultural differences and work to create inclusive, culturally competent treatment environments. Education and awareness campaigns can help reduce stigma and encourage women to seek appropriate care for sexual health concerns. Research continues to advance our understanding of female sexual interest/arousal disorder, leading to improved diagnostic criteria, treatment options, and outcomes. Ongoing studies are investigating new therapeutic approaches, including novel medications, innovative psychological interventions, and combination therapies. Understanding the neurobiological mechanisms underlying sexual desire and arousal continues to evolve, potentially leading to more targeted and effective treatments in the future. Healthcare providers play a crucial role in identifying, assessing, and treating female sexual interest/arousal disorder. Training and education for healthcare professionals about sexual health and dysfunction are essential for improving care quality and accessibility. Providers must be comfortable discussing sexual health concerns, knowledgeable about available treatment options, and skilled in providing sensitive, evidence-based care. Collaborative care approaches involving multiple healthcare professionals may be necessary for comprehensive treatment. The prognosis for women with female sexual interest/arousal disorder varies depending on individual factors, underlying causes, and treatment approaches. Many women experience significant improvement in symptoms with appropriate treatment, though recovery timelines can vary considerably. Early intervention, comprehensive assessment, and individualized treatment planning are associated with better outcomes. Long-term follow-up and ongoing support may be necessary to maintain improvements and address any recurring symptoms. In conclusion, female sexual interest/arousal disorder represents a complex, multifaceted condition that requires comprehensive understanding, sensitive assessment, and individualized treatment approaches. By addressing biological, psychological, and social factors contributing to the condition, healthcare providers can help women regain sexual satisfaction and improve their overall quality of life. Continued research, education, and awareness efforts are essential for advancing our understanding and treatment of this important women's health concern.